Alright, so I'm doing a presentation on dwarfism, and the overview. I'm just going to talk about what causes dwarfism, the etiology, just some common symptoms of dwarfism, and what common tissues and organs are affected. I'm gonna talk about if dwarfism is treatable, and if it is, what are the possible treatments that a person can undergo, and what are the short and long-term consequences. So how will it affect an individual throughout his or her lifespan? So dwarfism in humans may be caused by a number of conditions that occur before birth or in early childhood. The four major causes of dwarfism are an underactive or inactive pituitary gland, which contains the growth hormones, achondroplasia, which is the most common form. It's basically a failure of normal development in cartilage, emotional or nutritional deprivation, or Turner syndrome. My presentation is going to talk about achondroplasia since it's the most common form. And the picture on the right is a picture of a normal 4-year-old boy and then a 4-year-old boy with achondroplasia. And these boys happen to be twins. So as you can see, the boy on the right is a lot shorter. His arms are kind of bent back in a flex position, and his legs appeared to be a little bit bowed. But we'll talk about the symptoms in a little bit. So, achondroplasia is the most common form of dwarfism. Specifically, this type involves a gene mutation of the FGFR3 gene, and this gene is responsible for making a protein called fibroblast growth factor receptor 3. This gene is usually extremely important as it is involved in ossification, and because of this mutation, much of the cartilage does not convert to bone, making limbs short in stature. So if one parent has the condition, the child has a 50% chance of inheriting it. If both parents have the condition, the child has a 25% chance of having a normal stature, a 50% chance of having one defective FGFR3 gene, which causes dwarfism, achondroplasia, and a 25% chance of inheriting two defective genes. In this case, it would cause a fatal form of achondroplasia, and the infant would likely die in the first few months of living. So the symptoms, the most common and observable symptoms of achondroplasia are short stature, a normal sized torso, and short limbs, so short arms and legs. Other common symptoms are a larger forehead, wrinkled skin, a high-pitched voice, hypoglycemia during childhood, and a late onset of puberty. So this is an example of a child's left hand. As you can see, the cartilage has not formed between the bones. And this is a great example of what happens when the cartilage doesn't grow, making the bones in the fingers extremely short. So this picture, I'm going to pull it up here, um, is just a great example of some visual aids of a person with achondroplasia. So these are just the patients of the various ages. So at 5 months, he has a big forehead and kind of a outstretched stomach. But then at 3 years, his stomach is still outstretched a little bit, and then his bottom area is a little bit larger because his spine is curved a little bit, causing his stomach to go out. At age 14 or so, you can see that his arms are in a backwards flexed um, motion, and that's just when he's normally standing. And there's also the bowing of the legs is a very common symptom. Um, and usually their fingertips will go down to about their waist, no longer, because ours normally go down to maybe your mid thigh. But theirs only go down to about their waist. And this is just a picture of the curvature of the spine, as you can see. The spine is curving a little bit, and that causes the stomach to protrude out as well as the bottom. And these are just some pictures of some hands. The fingers are really short and they're kind of stubby. And his feet are also short as well. And this is a great picture of a person with achondroplasia, their forehead. It's very out front and larger than normal. And even his chin is very prominent um, compared to people without achondroplasia. So, affected organs and tissues. The most common tissues affected by achondroplasia are the bones and the cartilage. It affects the knees, elbows, head, legs, and hips the most. So the bones in the arm, like the humerus, radius, ulna, and then the femur in your thigh do not develop properly due to lack of bone formation. And that's once again due to the mutated FGFR3 gene, and this causes your legs to be shorter, and then your bones in your legs start to curve, making the bowed legs because of the lack of ossification, and making the cartilage between your bones. And due to having such a short stature, the spine is forced to decrease in interpendicular distance in the lumbar spine, and this causes problems as the person grows and develops. So they can have a lot of problems with their spine later in life and might possibly need surgery. The organs and organ systems that are most commonly affected are the nervous system, so the brain, spinal cord, and the nerves. The endocrine system, which is the pituitary gland that has the human growth hormone, and also the digestive system. The teeth are affected as well. People with achondroplasia are also extremely prone to ear infections. So basically, the middle ear contains the ossicles and the eustachian tube, and this is often smaller and slightly deformed in children with dwarfism. So these children are much more prone to bacterial infections of the ear, which can block the eustachian tube and cause ear infections. So they can have these a lot because of that. For treatment for dwarfism, unfortunately, there's no cure or specific treatment for achondroplasia. We can't just magically make them grow to a normal height. But you can work with your doctor to address certain issues you may be having. Um, for example, if you get persistent and reoccurring ear infections, a doctor can prescribe antibiotics. In severe cases of spinal stenosis, surgery may be necessary to fix the lumbar part of your spine if it gets severe. And some doctors also use growth hormones to increase the growth rate of a child's bones. However, the long-term effects on height and overall health have not been established, so these should be used um, rarely, but I think that if a person wants to grow a little bit more, they should check these out with their doctor. So short and long-term consequences. Complications of dwarfism-related disorders can vary greatly, but some complications are more common than others. For example, an increased death rate during the first year is a short-term consequence. Most of these deaths in infancy occur because of spinal-related issues. Um, but however, most consequences or complications of achondroplasia are long-term since there is no treatment for this disease as of right now. Affected individuals may have delays in motor skills development, frequent ear infections, and hearing loss, bowing of the legs, pressure on the spinal cord, crowded teeth, problems breathing, and narrowing of the channel in the lower spine. So this can definitely affect the physical activity, especially with the bowing of the legs and the pressure on the spinal cord. It may not be in the person's best interest to take on marathon running, since the bowing of the legs and running may be extremely painful. And these are my references. I hope you liked my presentation. Thank you.